Let's learn common medical English vocabulary used in American healthcare settings. Whether you're a nurse, nursing student, healthcare worker, or preparing for an English exam, these are words you'll hear every day in hospitals and clinics across the United States. Let's get started. First, let's talk about the difference between inpatient and outpatient. Inpatient care is provided to a patient who stays in the hospital overnight or longer. For example, I work on an inpatient surgical unit. Outpatient care is provided without an overnight hospital stay. For example, I'm looking for a job in an outpatient surgery center. Or she works in an outpatient clinic. Long-term care provides ongoing care for patients who need assistance with daily living or skilled nursing care. For example, I worked in a long-term care facility before becoming a hospital nurse. A resident is a person who lives in a long-term care facility, such as a nursing home. For example, the resident needs assistance with bathing. A physician is a medical doctor. For example, the physician ordered a CT scan. A registered nurse, or RN, provides patient care, administers medications, and coordinates care. For example, the RN completed the assessment. A licensed practical nurse, or LPN, provides basic nursing care under the supervision of an RN or physician. In some states, this role is called licensed vocational nurse, or LVN. For example, the LPN administered the patient's medications. A certified nursing assistant, or CNA, helps a patient with daily activities. For example, the CNA assisted the patient with breakfast. A nurse practitioner, or NP, can diagnose conditions, order tests, and prescribe medications. For example, the patient was seen by the nurse practitioner. Quick reminder, if you're planning to work as a nurse in the United States, the full Fluent Nurse course includes structured medical English lessons for American healthcare settings. You'll find the link below. Now let's continue. An IV delivers fluid or medications to a vein. For example, the nurse started an IV. A catheter is a tube inserted into the body to drain or deliver fluids. For example, the patient has a urinary catheter. An injection delivers medication using a needle. For example, the patient received an injection. A dressing covers and protects a wound, IV site, or incision. For example, the nurse changed the patient's dressing. A blood test helps evaluate a patient's health. For example, the doctor ordered blood tests. An X-ray creates images of bones or certain tissues. For example, the patient needs a chest X-ray. A CT scan provides detailed images of the body. For example, The patient is scheduled for a CT scan. An MRI uses magnets to create detailed images. For example, the physician ordered an MRI. An ultrasound uses sound waves to create images inside the body. For example, the patient had an ultrasound this morning. A diagnosis identifies a disease or condition. For example, the diagnosis is pneumonia. Treatment is care given to improve a condition. For example, the patient started treatment today. Admission is the process of entering the hospital. For example, the patient admission was completed. Discharge is the process of leaving the hospital. For example, the patient was discharged home. An assessment is an evaluation of a patient's condition. For example, the nurse completed a head-to-toe assessment. Great job! You've learned some of the most common medical English vocabulary in the United States. If you're a nurse learning English and don't know where to begin, download my free guide, 10 Steps to Confidence in Medical English. See you in the next lesson.